At behavioral health, one of the really unique aspects of our programs, and all of our programs, are that clients to us are individuals. They're human beings that have struggled a lot. And a lot of treatment centers, a lot of medical facilities look at addiction like it's something personally done wrong, like it's a weakness. And at behavioral health, we really understand through personal experience of our staff, as well as our clinical purview, that this has been a long road and a long struggle. And we're here to meet you with our hearts and our souls openly, and really make you a part of the behavioral health family.
We realize that oftentimes this is the first time that someone has reached out for help, whether it's for themselves or for a loved one. So it can be very intimidating to make that phone call. And what we want people to know is that, the person who answers that phone is, they understand and they are going to be able to help.
We really make an effort to make people feel welcome and comfortable as soon as they get here.
The physical environment is very, very important in behavioral health. We're always attempting to improve the quality of the environment that the patients are living in.
You get off that plane and you feel the warm tropical breeze, that's just kind of one of the first comforting things you'll feel, and that's first of many that you'll experience here.
One of the pluses, I believe, of our campus-style setting is that patients can walk around the campus. It's a 2+ acre campus in Florida. You're not confined to a unit. You're not confined to a hallway. You're not confined to a traditional hospital setting.
Behavioral health at the Palm Beaches was founded on a basis of respect. Respect for the patients and respect for the staff.
One of the most unique things about this center, and I like to say it's the spirit that runs through here, is the fact that everybody that works here, from the ground up all the way to the owners, is really dedicated to helping the people and putting the patients first.
We have a clinical team that's made up of a broad range of professionals, and they're all specialists in specific areas.
One of the things we're proudest of is our medical staffing. We continue to add new staff, and we have a variety of specialists. We have 3 board-certified psychiatrists. We have a cardiologist, we have internal medicine, we have a neurologist, and 3 of them are board certified in addiction medicine. This enables us to treat just about any patient that comes in the door.
I found out that, most of our patients, when they're out seeing general physicians, that most doctors and healthcare facilities don't like dealing with addicts and alcoholics. Okay, they find it very uncomfortable and they really don't know what their needs are. And I think that's what we're able to do specifically, is to take care of their needs, because we specialize in addictions.
We all understand the patient's pain when they come to see us. The reason for that is because we've all been there.
At Behavioral Health of the Palm Beaches, we try to instill hope in our patients by helping them recognize the issues that they've come to treatment for, and we work on mental, physical, and emotional and spiritual aspects of their treatment.
No 2 clients come to us with the same issues. It never happens. And so we look at the unique issues and how they've touched your life, and then we come up with unique interventions to treat them.
We're really looking at a whole person, and we want to find out what are the issues we have to help this person with. Once they stop using, how do we improve the quality of this person's life?
If you just take away someone's coping skills, oftentimes their addiction can be that, and you leave them with what they're trying to deal with themselves, it's too hard for them. If you take away somebody who was using something and it was helping their depression, they're going to go back into a depression unless we treat it and give them some skills on how to identify, how to help themselves, how to sort of dig themselves out of the hole. And we also utilize families for that, because when we help them sort of know some of those trigger signs, they can actually stop it before it starts again.
We have have a week-long family program that's open to all of the clients' families at Behavioral Health, and it's for them. The client only joins at the end of the day. It's really about healing the wounds of the family and helping the family have boundaries and emotional support so that they can take care of themselves. Because when the client comes home, the client's doing well, the client knows what they need to do, but the family is left feeling like they've been used and abused, and it hurts. And this brings both together so that both the family and the individual come together on the path to wellness.
The patients really come to rely upon that and are grateful that we can draw the families into every aspect of their recovery, because their chance of relapsing when they leave is far less if the families make that kind of a commitment to the patient.
Behavioral health, critically important, is the process of aftercare planning and the continuing care plan for the client, without which all of our efforts would be for naught.
Everyone here is seen by a psychiatrist within 2 weeks, and that is done for them to help them facilitate a good transition back out into the community. If they have medical problems, their labs and their diagnoses have been already conveyed to their primary care doctor, and if a specialist is needed, they're sent to a specialist. And so that all of these pieces to a puzzle are taken care of for them, so that they don't feel like they're sort of out on a limb, got all this wonderful treatment, and then they can't continue it. Because it's not just treatment while you're here. We want you to continue to be successful and to sort of have all those pieces to a puzzle for you when you leave here.
It's a huge support for our clients, and we hear, people, alumni that come back a year, 2 years, 3 years later, 5 years later even, to tell their story, and they talk about how helpful that was in the transition between treatment and their regular life. And part of that is aftercare programs that involve intensive outpatient programs, where they're with us for 3-4 days a week, to even just seeing a clinician once a week or twice a week, to being in attendance at alumni phone calls. We do alumni Skype sessions where clients get to see people they were in treatment with, and they get support from a team that they felt very comfortable with. And it really helps them cross that bridge from treatment to a sober lifestyle.
We feel so fortunate to be able to do what we do, to watch families come back together, to be the first step in this healing process, and to offer hope, even if it's just a little glimmer of hope, So please pick up the phone and call. We're here to help.
There is hope. We can help. That is our tagline, and that is very, very, that's very much to the core of who we are.
There is hope. We can help.